So what if we have a patient, we've done our prone cuff testing, and they're still finding it difficult to get that passive equals joint active range? Perhaps pain is prohibiting, or they just simply can't do it. How do we apply those facilitation principles in this position? It's really very easy. So let's say that Jack, this is his passive range, but actively he can't achieve that. What are my options? Well, the first thing is to make a fist. So I get Jack to make a fist and ask him to lift up. Does that make it easier? Yes, no. If it does, fantastic. He's going to do supported cuff exercises with that fist. If that doesn't make a difference, or it makes a little bit of difference and is still uncomfortable, or they just can't do the movement, I can make a fist again, but then remember the power of compression to really help the rotator cuff and that feed forward activation. So the way that I apply that is through the olecranon along the axis of the humerus. And literally, I'm just going to do a little bit of pressure straight up towards the glenoid, and again ask Jack to repeat that movement. Does it make it easier? Yes, no. Again, if those things haven't made a difference, or I've still got pain, or I still haven't got that full active through passive range, my final option is to add some resistance. I would always start with making that fist again, but then what I'm going to ask Jack to do is push me out of the way and see if that makes a difference. Now you may see that Jack's just slightly trying to flex his elbow and only deviate his wrist, so it's really important again that I keep that 90-90. So again, make a fist and just gentle resistance, push me out of the way, much better. And then you can see really nice quality movement. So as ever, making a fist and compression are a great way to really reinforce that feed forward, that initial stiffness before movement, but also our resistance can be a great sensory cue just to change that muscle recruitment strategy. Now, those are really nice, simple things to do. You will see some people will actually put a hand on the scapula and again see if that makes some additional benefit. I don't tend to use that so much with this particular test just because it's harder to set up in terms of the exercise the patient's doing at home. But there's nothing to stop giving that little bit of pressure and again making the fist and seeing if that's the thing that makes the difference. All these things, the key thing is it's informing an exercise that you give to your patient that they associate with what made the biggest difference to their pain or how easy it was to do their movement. Now, the other thing that we've talked about during the course is the importance of the kinetic chain and how potentially it can make life much easier for the shoulder. When you're trying to buy people into that concept, a very simple, easy test that you can do, as long as the patient's not painful in that 90-90 position, is ask them to hold the arm there and then don't let me push down. So don't let me push. Lovely. Then I'm going to ask him to keep that there whilst I add in hip extension. So I'm really going to get the glutes firing. So now Jack's going to lift that leg off the plinth and then he's going to push his arm at the same time. And you can see he's much, much stronger. Now I'd expect there to be some difference when I add in the lower quadrant, but there's two things that achieves. It gets the patient to see by working the whole body, it makes the local arm stronger, it gets that muscle system doing its job. But for me, if there's a huge difference, then again, for me, it just adds some credibility to the relevance of that, both in my exercise prescription, but also hearing that patient history. So some really simple things that you can immediately use in a patient that's perhaps struggling to get that range or pain is preventing. Use those simple facilitation techniques, but also a way of buying patients in terms of that kinetic chain.